I just put the Picato on my face. It's a form of chemotherapy for actinic keratosis. Just want to show you the places. It's just a couple of places on my nose, one on my lip, one on my face here, one right there. So it's a 3-day supply, and it'll I want to just show you the reactions because it says that there can be some reactions. So I just wanted to show you what it looked like prior. Well, I just put it on there. There's one there. I have a couple there. One there. One there. One there. Kind of a bigger one there. And on my lip. So this is day 1. Just put it on. So I just want to let you follow along with me on how this works out for me. Hopefully I won't get no reactions. Got my fingers crossed because they said there is, you could get skin irritation, infection, things like that. So we'll see you tomorrow. Bye. So here is the medicine. It's been about probably 2.5 hours. So you're already seeing it getting red, especially this one right here, and the one on my lip is really burning. So kind of like a sunburn. I mean, not unbearable or anything, but kind of just a little bit tender. So I can see it must be working. These up here, I really don't feel it at all. It just feels a little bit tight. But okay, so this is about 2.5 hours after I put the medicine on, day 1. So hopefully that's about as bad as it'll get. Ooh, but I doubt that. Okay, bye. Okay, so this is, it's been 6 hours, and as you can see, definitely starting to work, and it's burning, especially this place right here. It still feels like a sunburn. This one is just tingling a little bit, and the one on my lip is burning. The rest of them here aren't too bad, but yeah, this one are the two that seems to be a little more sensitive. So I took a shower because you have to wait 6 hours to take a shower. So that's what I did. And it kind of stung a little bit when the water was hitting it. I used a really mild soap on it. Not my normal face scrub that I use. So, okay. So probably this will be my last one until in the morning. Bye. So I just put the second dose on, and this one has a blister right there. I don't know if you can see it. So right there. So yeah, I think this one has had the worst reaction. And like I said before, these two were the ones that was burning the most. But anyway, so I just put the second treatment on. and we'll see how it goes. So far it's not burning, but that's the way it did last time. It started burning a little bit later. I also decided I had a little bit left over, so I decided to treat an area on my chest right here. So we'll see. Alrighty, talk to you later. So this is day 2 after I took my shower, and this one and this one is definitely the worst, had the worst reaction. They're not burning all that much today. They're just a little bit sensitive. So far, I think it's not too awful bad, but you know, they said that it goes through steps, so it still might look worse before it starts looking a little bit better. So that's it. Day 2, second treatment after my shower. So, bye. Okay, so we're going on day 3, and I just put the third and last dose on. So yesterday it didn't burn. It wasn't burning. They're a little bit sore. This one's sore and this one's sore. So it just feels like a little sore. It's not real bad. And so I think the overall reaction hasn't been too bad. So now, after today's dose, they should start healing pretty quickly, hopefully. I think the main concern now that I haven't had a severe reaction or anything is probably infection. So I use a mild antibacterial soap on it when I take my shower and then in the evening before I go to bed. So so far so good. So we just have to make sure that at the end they're going to be gone. They should scab up and kind of just peel off. So, alrighty, talk to you later. Okay, so this is day 4, and it's starting to peel a little bit, and I'm going to put some lotion on them. To see if that helps a little bit with the peeling. So the lip is still sore and this one's just a little bit sore. So that's that, day 4. Okay, so this is day 5, and I put a little bit of makeup on them, but they're still pretty dry, still peeling quite a bit. But the soreness, the lip is just a little bit tingly, but yeah, they're still peeling. So it's been 5 days. Here's the one on my forehead. There's that one. So like I said, I have a little bit of makeup on because I was out shopping. It's New Year's Eve. So I had some things I had to pick up, and when I put lotion on them, I've been using the it's a Meyer brand. It's comparable to Aquifer, and it stings a little bit, but it seems to help. When it started peeling this morning when I got up, it was a lot of it had flaked off. So when I washed my face, it did pretty good. So that's it. day 5. See you tomorrow. Okay, guys, so this is day 6 in the afternoon after my shower, and I want to show you they're healing very nicely. There's absolutely no soreness, a little tightness because they are still peeling a bit, but with a little makeup it just covers that right up, except for the little flaky parts. But all in all, I think it's done pretty good. And the place on my neck, I had mentioned that I had treated. There was really no reaction at all. So when I did a little further investigation, I seen that they do have a stronger strength for the other places than your face. So maybe that was why. And I did want to mention a couple of points. The medicine is supposed to be refrigerated. That's in the instructions. Also, each tube is a one-time use, and you throw it away once it's been opened. And there's 3 treatments, so you do it 3 consecutive days. The first day seemed to be the worst reaction for me. And then I also wanted to mention that it really wasn't that bad. You know, I waited a while. I think I got the medicine about 6 months ago, and kept trying to find a time that I could be off work. And I go back to work. This is Friday afternoon. I go back to work Tuesday. And so I don't think there'll be any problem at all with the cosmetic part of it. And this will be my last video, unless, you know, something happens in between, and then I can always edit and put that in. So I hope everybody's experience is no worse than mine, and it really wasn't bad at all. And I think that's about it. Oh, and I did want to mention, I hope everybody does well if they decide to do this, and take care. And you can comment below. I would enjoy seeing how your experience was. And thank you. Bye. I did want to add one more thing. There's a very small amount in each tube. So if you have several places to treat, you might want to, on the first tube, kind of squeeze it out on your fingertip to make sure that you have enough for each place and you don't put too much on one and not have enough for the other. It's very small. I don't even know how to explain it. Maybe about the size of a pea, a small pea, like a young baby pea. It's a very, very small amount. So that's only, I just wanted to add that information in. So take care. Bye.